Welcome to the GVK EMRI Trauma Refresher course. In this module, we will talk about mass casualty incidents, or MCI. We want you to learn two things from this module: how to triage patients, including knowing how to prioritize treatment, even if you just have 3 patients at a scene, and what to do if you are the first EMT on the scene of a mass casualty incident. You are called to the scene of a fire. As you and your pilot are driving in, you are considering how you will manage the scene. Fire and police are on the way. As we have discussed, emergencies can be stressful because the patient needs advanced care in a short amount of time. But as you arrive on scene, you realize that instead of 1 or 2 sick patients, you have at least 20. And at this point, it is only you to manage the scene. When the number of patients exceeds the resources available, this is what defines a mass casualty incident. MCIs can be natural disasters or man-made disasters, both intentional, such as a terrorist attack, or unintentional, like a factory explosion. Preparation is the most important piece to manage a mass casualty incident. Fortunately, GVK EMRI has the protocols and training in place like this to ensure the response is coordinated, organized, and as effective as possible to minimize the loss of life and the loss of limb. When you care for a single patient on scene, you proceed with your trauma algorithms that we have discussed in these modules. With these patients, you are able to focus all of your attention, time, supplies, and ambulance space on that individual. In other words, the resources are greater than the need of the patient. But in a disaster, the needs are greater than the resources available. So we try to allocate our limited resources to do the greatest good for the greatest number. As a result, we begin to prioritize one patient's treatment over another to help save more lives. This decision process is called triage. Making those decisions about who may live and who may not live are heavy and incredibly difficult. Yet to do the most good for the most number, these decisions have to be made, and made quickly, as time is limited. GVK EMRI has a decision tool to help you make these critical decisions in the moment. There are 4 triage colors. Red indicates the patient needs immediate treatment. Yellow indicates the patient can wait a little bit. Green signifies a patient with minor injuries, also known as the walking well. And black signifies dead or expected dead. Each patient is marked a color with a piece of tape or ribbon. GVK EMRI uses this algorithm to figure out what color to assign to a patient. So let's walk through these decision steps. Please come. The first question to ask: if you can hear the sound of my voice, walk toward me. Those patients who are able to get up receive a very brief assessment and are tagged green if they need any treatment at all, and if not, they will proceed to the survivor reception area. The triage officer then begins to assess and triage all injured patients who cannot walk. Do not perform a full trauma assessment as you are triaging patients. A full assessment takes too much time, which is a resource in and of itself. Additionally, remember, do not take the time to move the patients who have already been triaged to the treatment area. Keep triaging until all of the patients have been assigned a color, and then you can help with the other roles. The next question is the patient breathing? This is a yes or no question and should not take longer than 5 to 10 seconds to evaluate. If the patient is not breathing, you should perform a single jaw thrust maneuver to open their airway. No bag, no oxygen, no oral airway, just a jaw thrust. If the patient takes a breath, they are categorized as red and need immediate treatment. If the patient does not take a breath, they are categorized as black and should be taken to the morgue area. For all the patients who are breathing, we next calculate their respiratory rate. If it is significantly abnormal, meaning less than 10 or greater than 29 breaths per minute, the patient is categorized as a red and should receive immediate treatment. If the respiratory rate is between 10 and 29 breaths per minute, continue on to check their pulse. If the patient's pulse is greater than 120 beats per minute, or the radial pulse is not palpable, the patient is categorized as red and should receive immediate treatment. If the pulse is less than 120, continue on to assess mental status. While you are assessing mental status, ask the patient to perform a simple command. For example, can you show me your thumb? Can you open your eyes? If the patient is able to follow these commands, they are tagged yellow. If the patient is not following commands, in other words, they are confused or unconscious, tag them as red. Let us return to our case. Again, you are called to the scene of a fire, and instead of 1 to 2 patients, you find 20 needing help. The fire was actually ignited by a bomb, and you are the only ambulance at the scene. But before becoming involved in any scene, and particularly a mass casualty incident, you have a very important first priority. What is the biggest priority before entering any scene, and particularly an MCI? The biggest priority is safety. Remember, safety is always paramount, and even if your heart tells you otherwise, you have to prioritize your safety and the safety of your partners and other rescuer lives first. Then consider the safety of the patients and bystanders. This will actually save more lives. The first ambulance arriving on scene has a very important and big job. That is, to call for help. There is no way that as a single EMT, you will be able to care for all of those patients. The ERC physician will need as much information about the MCI as possible, and there is a special type of report that you will give over the phone before you start to triage patients. This verbal report is called methane. Get ready, write this down in your workbook. M is my call sign, or major incident declared. E, the exact location, referring to the city grid or GPS where the MCI has occurred. T equals type of incident. Is it a highway accident with many victims? A mudslide? H, are there any hazards present, such as a gunman or construction hazards? A equals access to the scene, although this is not something as an EMT that you need to worry about. N is the estimated number of patients. You will likely not have an exact number, but try to estimate as best as you can. E equals emergency services currently present at the scene, meaning, are there any other ambulances? Are police and fire already present? We will practice what we learned today in the skills sessions this afternoon, but for now, let's review. Let's go through some of the pre-test questions. You are dispatched to the site of a collapsed bridge. As the first ambulance on scene, what should you do? First, you want to confirm that it is a mass casualty incident. Then you will do a brief scene survey, which will gather just enough information to give a methane report to the ERC physician. You are the triage officer at an MCI. You are approached by a patient who has a 1-inch scalp laceration and he is asking you for pain medication. What do you do next? Do you ask him to go to the survivor reception area, or do you mark him as green and send him to the green treatment officer? That's right, he still has an injury, so mark him as green and send him to the green treatment officer. Next, you arrive at the scene of a bus accident. There are multiple patients, and you are the first ambulance on the scene. As the first care provider on the scene, what is your number one priority? Safety. That is first the safety of your life, followed by the safety of your partner's lives and fellow rescuers' lives, followed by the safety of patients. Your safety comes first. When triaging patients, what is the first question you should ask to help determine or sort out the green patients? You should yell out over the scene, "If you can hear the sound of my voice, walk toward me." What is the difference between a patient who is triaged as black versus a patient who is triaged as red? Black patients are not breathing when you first assess them, and even after performing a jaw thrust, they do not take a breath. Red patients, however, they may or may not be breathing when you first assess them, but after jaw thrust, they do take a breath, so they are categorized as red and need immediate treatment. What does methane stand for? M is major incident declared and my call sign, which is your ambulance unit number. E, the exact location. T, type of incident. H, hazards. A, access to the scene, which you as an EMTB will not worry about. N, an estimated number of victims. And E, emergency services that are currently at the scene. Give some good examples of questions to ask to distinguish a red patient from a yellow patient. Red patients are different from yellow patients due to their mental status. Red patients have confusion of some sort. So ask them to follow a simple command. Can you open your eyes? Can you show me your thumb? Okay, great job. So a quick summary. Preparation is the most important piece of a mass casualty incident. Your treatment paradigm in an MCI switches to strategies to provide the greatest good for the greatest number. Remember, your own safety is paramount to enable the greatest good for the greatest number. The triage system uses red, yellow, green, and black to categorize patients based on how sick they are. The triage system uses the patient's ability to walk, their respirations, pulse, and mental status to help place them into different categories. Make sure you know these categories and make sure you know this treatment algorithm if you are ever in the position of triage officer or first ambulance on the scene. Okay, awesome work.